we're waiting for those answers.
Let's listen in to the questions and the answers. Here's the Prime Minister.
You're worried about your job or your business. You're concerned about your health or the health of an elderly parent. No matter what this has meant for you, I know you're looking for answers. Knowing where we are now and where we might be in the coming weeks and months is how we can all figure out our response. For you, that could be planning on how to make sure the kids keep learning even though they're at home. For our government, the numbers and data compiled by our experts are critical to understanding the scope of this pandemic and informing the decisions we make to keep you safe. And we've made sure you can access the most reliable, accurate information available to us at canada.ca/coronavirus. We're going to keep releasing up-to-date data on a daily basis and using it to inform our decisions. And we'll continue working with the provinces and territories on getting new information to have a complete national picture that we'll share with you. Regardless of the varying models or predictions, one thing is consistently clear. The measures that have been put in place by all orders of government, from closing schools to staying home, are saving lives. But this will only keep working if everyone continues to do their part. If everyone takes their duty, to nurses and doctors, to the elderly and to the vulnerable, seriously. As seriously as if it were the life of their parent or their child on the line. Because it is. The cashier at the store is someone's brother. The paramedic saving lives is someone's wife. That's what's at stake here. The lives of the people we love, the lives of the people our neighbors love. So do your part. Wash your hands, stay 2 meters away from each other, and above all, stay home.
For a number of weeks now, we have been staying home. That's what we need to do, in addition to keeping our distance and washing our hands. In fact, it's at home that most of us feel the safest right at this time. But just imagine if you were more afraid to stay home than to confront the pandemic. Unfortunately, that is the reality for too many Canadians. It is their daily experience, women who are fleeing violence. No mother should have to choose between keeping her children in a house where they're not safe or taking them to a place where they could fall sick. We therefore invested $40 million in shelters for women and centers that help women facing violence. For women and Indigenous women and children, we have invested $10 million in emergency shelters. This money will help women's shelters to take all the necessary measures to protect the people against violence, but also against COVID-19. To help the homeless, we increased by more than $157 million the funding of the program to help the homeless. People will be able to buy additional beds or hire or rent new facilities to house them. And we know that there are centers like this in all the major cities. It's not just about helping people a safe place to escape violence or to avoid sleeping in the street. We must protect all members of our society against COVID-19, and that includes the most vulnerable.
No one should have to choose between being somewhere they're unsafe and risking getting COVID-19. That's why we've invested $40 million for women's shelters and sexual assault centers across the country. And for Indigenous women and children fleeing violence, we're providing $10 million for emergency shelters. For other shelters, we've boosted funding for the Reaching Home program by over $157 million. This will help buy things like physical barriers or rent new space to keep people safe. The communities that need this funding have now been identified, and money is getting to them. For people from Victoria to Hamilton and Regina to St. John's, help has arrived. I know we're asking a lot right now. To stay home, to not see friends, to close your business temporarily. It's not easy. I get that. But these sacrifices are necessary. The price of acting otherwise is just too steep. To those who are sick right now or have family in hospital, in the ICU. To those who've lost a loved one or a friend, we're thinking of you, we're here for you, and you remind us of what's on the line. We all need to take physical distancing very seriously. Done right, these measures will save lives and bridge us slowly but surely back to normal. At the same time, we're working around the clock to get Canada the resources we need. In the next 48 hours, we will be receiving a shipment of millions of masks by a chartered cargo flight. We're also working with provinces to transport their medical supplies when possible. Items ordered by Quebec will be on this flight. Our government has also leased a warehouse in China to help collect and distribute these items as quickly as possible. And going forward, the flights we're chartering to get the materials here include Canadian companies Cargojet and Air Canada. I want to take a moment to thank everyone, whether you're working in a warehouse, flying the plane, or part of the ground crew, for your dedication.
Looks like we have a bit of a technical difficulty there. I'll just recap until we get things fixed, what the Prime Minister is saying. Oh, I hear him now. Never mind. We'll swing back there.
We're doing everything we can to support you while you do your part. So this weekend, stay at home. Protect your loved ones and our frontline workers. Save lives. I want to take a moment to talk to kids again today. Even at home, there's lots of stuff going on. There's lots of stuff to do. I'll be holding a video conference tomorrow with Dr. Tam to talk through some of your questions. I know a lot of you have sent them in, and I look forward to seeing you tomorrow. Tomorrow, you'll also have a chance to ask someone who knows better than anyone else about staying inside, an astronaut. Canadian astronaut Jeremy Hansen will be live on YouTube tomorrow to talk with you. So ask your parents to help send in a question ahead of time. Aux enfants, je sais que vous avez beaucoup de
To the
questions.
kids out there, I know you have a lot of questions. So tomorrow, you can listen to our video conference with Dr. Tam, where I will be answering your questions. And don't forget that the Canadian astronaut Jeremy Hansen will be online on YouTube tomorrow. In order to protect your wages and the economy, we developed a three-point plan, which will allow us to protect jobs, support small and medium-sized businesses, and help those who have lost their paycheck. To protect your health and the health of all our essential workers, we are working with many different companies to manufacture and distribute medical equipment and PPE. We will help you. We will help you to come through the storm. But we need you to do your share. I know that I can rely on you to do that. This weekend, stay home and save our frontline workers. Save lives. Thank you.
Thank you, Prime Minister. We'll now take some questions from the phone. As a reminder, one question, one follow-up. Over to you, operator.
Thank you. Merci. The first question is from Teresa Wright from the Canadian Press. Your line is open. Votre ligne est ouverte.
Good morning, Prime Minister. Yesterday, in response to questions about the White House order for the U.S. to stop exporting N95 masks, you mentioned the thousands of nurses in Windsor that go across the bridge to Detroit every day. Is Canada considering stopping those nurses from going to the U.S. as a retaliatory measure?
No, we recognize that our countries are deeply interlinked in sometimes very complex ways. The necessary goods and services that flow back and forth across our border keep us both safe and help us on both sides of the border. We are continuing to engage in constructive discussions with different levels within the administration to highlight that the U.S. will be hurting itself as much as Canada will be hurting if we see an interruption of essential goods and services flow back and forth across the border. We continue to demonstrate that this is a good thing for both of our countries, and we look to continue to ensure that essential supplies get across the border.
How concerned are you that those arguments at that pace that you're trying to make could be falling on deaf ears?
We've had extremely constructive conversations with the Americans over the past weeks throughout this crisis, and we continue to get very good response from them on this issue as well.
Thank you, Teresa. Next question, operator.
Thank you. Merci. The next question is from Rod Nickel from Reuters News. Your line is open. Votre parole est à vous.
Prime Minister, Premier Kenney said yesterday that his government will take part in next week's OPEC Plus conference call. Will your government participate in that conference call whenever it happens? And what specific outcome in terms of global supply cuts is your government looking for?
As you know, that conference call, that meeting for Monday has been cancelled. We're continuing to engage with our partners and look very carefully at how we can ensure that Canada's perspective and Canada's voice is heard during these important deliberations.
And just as a follow-up, to what extent is your government holding off on finalizing its oil support package pending these global talks about supply cuts?
No, we are continuing to work forward regardless of what happens in the global context on support for oil and gas workers who are suffering. But that is why at the same time we move forward early on in direct support for workers across the country in all industries. The wage subsidy and the CERB will be there to support Canadians who've fallen onto difficult times because of COVID-19.
We recognize that we have to ensure that we can help workers in those industries that have been deeply affected, such as the oil and gas sector, and we will continue to look at how we can do that in the next little while. At the same time, I want to say that the measures we have put forward, whether it's the wage subsidy or the Canada Emergency Response Benefit, will help people in all those industries right across the country who have fallen on hard times because of COVID-19.
Next question, operator.
Thank you. Merci. The next question is from Catherine Lévesque, La Presse Canadienne. Your line is open. La parole est à vous.
Good morning, Mr. Trudeau. I'd just like to come back to what you said about the masks that will be coming to Canada soon. You said that includes the ones ordered by Quebec. Are those from 3M or where are they from? These are masks that are coming from China. We are currently working to ensure that the supply chain between China and Canada continues to operate, and that is the order I referred to. Thank you. And coming back to Mr. Trump, I wondered, did you call him or do you intend to call President Trump? And is there any other way, perhaps use the new NAFTA, that we could do something about the masks? Well, since the crisis began, I've been speaking regularly with the U.S. President, and I intend to speak to him again very soon. But for the time being, the discussions are being held at various levels of the administration, and we're pointing out to them that essential goods and services flow across the border on both sides. We have nurses who work on the other side of the border, and in terms of gloves and other types of equipment and test kits, the fact is we supply that equipment to the United States. Our economies are so interconnected that it would really hurt both countries to block that supply chain.
I will be speaking to President Trump in the coming days. I have spoken with him a number of times over the past weeks since the virus really started to hit hard. We're continuing to engage at all levels with the administration, having very constructive conversations, highlighting that the flow of goods and services that are essential to both of our countries flow both ways across the borders, from medical professionals right across the country who live in Canada and work in the United States, to essential goods from gloves to testing kits that Canada ships to the United States. It is in both of our interests to maintain this extraordinary close relationship.
Thank you, and we'll take one more question on the phone, operator.
Thank you. Merci. We have a question from Michel Lamarche, TVA. Your line is now open. La parole est à vous.
Bonjour, Monsieur Trudeau.
Good morning, Mr. Trudeau. I'd like to know whether you have spoken to the Americans in your recent discussions about the fact that pulp and paper used to produce those N95 masks comes mainly from Canada and Nanaimo, BC. Have you talked to them about that? Have you reflected on that with them? Yes, we have pointed out to the U.S. all the different materials and services that flow back and forth across the border. We do not want to start limiting our exports or the services that we provide to the United States. We understand that both of our countries will be much better off if we continue to count on each other. And I'm confident that we will be able to find a solution to this situation.
We have highlighted in many different ways the very many different products and resources that flow across the border in both directions to ensure success for our economies, success in keeping our citizens safe. We are not looking at retaliatory measures or measures that are punitive. We know that it is in both of our interests to continue to work collaboratively and cooperatively to keep our citizens safe, and that's very much the tenor of our conversations, and I'm confident that we're going to get there.
Monsieur Trudeau,
Mr. Trudeau, we are now aware of the Ontario scenarios. I imagine you saw them yesterday. I'd like to know how you reacted, and do they resemble the scenarios for Canada as a whole, and when will you be releasing them? Yes, we saw the Ontario scenarios. We're waiting for the ones from Quebec, which will be available in a few days, and we are constantly working with the provinces and territories to get the correct data and the right information to be able to prepare proper projections for Canadians and answer the questions that everyone has. How serious will this become? When will we be able to cut back on some of the measures currently in place? But I just want to say that every model, every prediction, every projection is based on the fact that we must stay home. We must limit our movements. We must keep a 2-meter distance from others. We must continue to wash our hands. This behavior will help Canadians, and it will ensure that whatever model we're talking about, we will get the best possible results, and there will be the least amount of damage and the fewest deaths possible. Now, there will be more modeling and data released in the next few days, but in the meantime, it's important for Canadians to look at what the numbers are, and we're waiting for numbers from the province for that to happen.
People want to know how bad this is going to get, how much longer it's going to last. We saw modeling and predictions from Ontario yesterday. We know we're getting more modeling and predictions from Quebec in the coming days. Canada, at the federal level, will continue to pull together the information and make models and predictions based on that. But regardless of the curves and the models put forward, one thing is consistent throughout all those predictions, that the more people stay self-isolated, stay at home, keep that 2 meters of distance from each other, don't go out unless absolutely necessary, and wash their hands regularly, the better off we'll be. We will be continuing to share up-to-the-minute data on canada.ca/coronavirus. Please go check it out, see all the public data, the data that we're making public from all across the provinces, and we will continue to build and share our predictions in the coming days on how Canada is going to be doing as a whole.
Hi, Prime Minister. Mackenzie Gray with CTV. Kind of following up on the previous question, yesterday when the Ontario government put out the projections, they said that between 3,000 and 15,000 Ontarians potentially could die from COVID-19, that we could be in this from 18 to 2 years, and that potentially could be 3 waves of this. You've seen the projections that Dr. Tam and Public Health have put forward. Are the models that Ontario put forward consistent with what you've seen so far?
From the very beginning, we've seen a range of models talking about the coming weeks and months to much longer than that, talking about very high numbers of possible deaths to talking about very low numbers of possible deaths. We know the situation is serious. We know there are a range of possibilities, and every given model will just give those range of possibilities. What actually happens depends on the choices and the actions that we take every single day. That's why, regardless of the model that is put out there, we can impact that model, we can change the predictions based on how we act. Staying home, keeping 2 meters distant, and washing your hands.
Dr. Donnelly referenced yesterday that Ontario was be able to make predictions on the mortality rate largely because we're able to look at international data that we've been able to collect so far on mortality rate. If that's the case and Ontario's been able to put out projection, other provinces are going to do so, why can the federal government not confidently put out a number right now?
Well, we recognize that different countries around the world face very different mortality rates, very different situations depending on their local circumstances. The same way in Canada, the way different provinces are experiencing, are handling, are bringing in measures to adjust to their situations vary as well. And at the federal level, we depend on collating, collecting, and aligning all that data from the provinces in order to build a better picture of what's going to happen across the country. We've seen different provinces put out numbers, put out data, put out models, but before we can get to a proper national model, we need to have an even better idea of what we're doing in various provinces. Okay. Nous reconnaissons que différentes provinces ont différentes circonstances, comme on voit des pays à travers le monde dont les situations extrêmement différentes, dépendamment de ce qu'ils sont en train de vivre. C'est pour ça qu'au niveau fédéral, pour rassembler
when it comes to developing an idea of what Canada is going to be facing across the country and developing projections, we have to use models and data and projections from the provinces. That's what we're doing now. We are collating all of that data and aligning that data so that we can share that with you in the coming days and give you a vision of what Canada can expect.
Last night, President Trump made it very clear that he's unmoved by your urgings and that he will go ahead with this ban on exports. So what is the number, what is the impact that this has on Canada's medical supplies?
As we've said, we have been working day and night to source medical supplies for Canadian frontline workers. We have shipments coming in the next 24 hours. We've received shipments over the past days. We continue to work with suppliers around the world to ensure that we do get the medical equipment that we need, and we have more coming in regularly. At the same time, we're working with the American Market Administration to ensure that they understand that goods and services that are essential to both our countries flow in both directions across the border, and it is not in any of our interests to actually limit that flow. We are also, of course, turning towards Canadian manufacturers as the tremendous effort that Canadian companies are putting in to develop made in Canada products, PPE, equipment, and medical supplies that is going to actually not just supply Canada, but be there to supply other countries who need them as we meet our own needs. This is part of what Canada is doing to ensure that we are protecting our frontline workers and all Canadians every single day.
Sorry, go ahead.
Okay. Nous allons continuer de travailler pour amener les produits essentiels à travers le monde.
Essential goods in from around the world. We will continue to work with the U.S. administration and point out to them that it is in the interests of both our countries to ensure that we have the essential goods and services we require on both sides of the border, and we will continue to work with industries across Canada to develop Canada-made solutions to keep all our workers safe.
An answer on how much the impact is. I mean, you don't have the numbers, or does it mean you're not willing to share it? And given that the EU has also done this several weeks ago now, why isn't Canada doing the same?
We understand that it is really important to keep global supply chains flowing. We know that Canadian frontline workers are depending on the arrival of PPE from around the world, and that's why we are facilitating those arrivals. They've arrived last week. We've got more coming in the coming days. We will continue to work to ensure that that comes in. We're also continuing to impress upon countries around the world that they are hurting themselves when they limit the flow of essential goods across their borders. We need to work together to make it through this global pandemic. That is what Canada will always do.
Brian Mullen, Global News. A question about testing. Why didn't Canada start procuring tests earlier when we saw what was happening in China? Are you concerned with the limited amount of testing means that you don't have an accurate picture of what's going on to inform policy, especially the potential role of asymptomatic people silently infecting other Canadians, which more testing would have identified?
Canada has been doing an awful lot of testing. We have been ramping up testing. We've certainly done more testing than a lot of other countries like the United States. And we've seen that early and strong testing in places like Alberta and BC have been very, very effective at managing and controlling the spread of COVID-19. We recognize that mass testing and accurate rapid results are a key part of managing the virus going forward, of ensuring that we continue to be safe through the coming months, and that's why we are increasing our testing capacity every single day.
We recognize that test kits are absolutely critical in order to manage the spread of the virus. And of course, we are doing well in terms of testing in Canada, but we can always do more. And that's one of the reasons why we are constantly increasing our testing capacity. In British Columbia and in Alberta, for example, the testing kits have been very effective, and the testing in general have been effective in controlling the spread of the virus. We know that we have to do more across the country, and that's why every day we are increasing our screening capacity.
CBC News. Are you concerned that the battle we're seeing over face masks, such as the one we're seeing now with 3M, could extend to other medical supplies and medications to treat COVID-19? Could this just be the tip of the iceberg, and what are you planning to do about it?
That is one of the reasons why we have turned towards Canada's local industrial capacity to develop these solutions for the coming weeks. We know that Made in Canada solutions are on their way because thousands of businesses, of manufacturers across this country are stepping up, are switching their assembly lines and supply lines over towards producing the necessary medical supplies and equipment that we need. In the meantime, we will continue to source source these products from suppliers around the world. Shipments are coming in over the next 48 hours. We've had shipments come in over the past few days. We're going to continue to do everything we can to ensure that our frontline workers get the support and the protection they need.
But do you have concerns that these shipments could be in jeopardy?
Okay, we know that there is a global competition for these products. Every country in the world needs more of them. That's why Canada is shifting over so much of its industrial production to develop these masks, these solutions, these equipment, so that we can cover our own needs over the medium and long term, and be there to help other countries at a point where we have enough for ourselves as we manage the spread of COVID-19. At the same time, in the short term, we're continuing to procure the necessary equipment that our women and men on the front lines need right now. We
know that there is a global competition out there in terms of trying to secure masks, and that's why we are now trying to develop our domestic capacity to produce this equipment, this critical equipment, to protect our frontline workers. This is a solution that will be in place in the medium term, and in the short term, we will be receiving shipments of material from around the world, which we need to keep our citizens safe. Radio-Canada, you spoke to Mr. Trump about NAFTA and about the masks. With respect to NAFTA, would there be a point in waiting to implement it, as some industry groups are asking, because of a global pandemic? Do you think it would be a good idea to postpone it, or do you want it to be implemented right away? And in terms of masks, what exactly are you going to say to him? How can you negotiate with him on this? Well, with respect to NAFTA, we understand that the process of harmonizing regulations will take a certain amount of time and work. There are people in the government working on this now, but of course we have a lot on our plate right now in responding to COVID-19. But I can assure people that the new NAFTA agreement will come into force very soon. NAFTA, the current NAFTA, in the meantime, remains in effect and will guarantee free trade with the United States. So we will be coordinating this effort with the U.S. and Mexico, but our priority right now is to continue to do everything we can to protect Canadians and fight COVID-19. In terms of my conversation with the President, I pointed out to him that there are healthcare workers in Canada who work along the border and on whom they depend. And there are also a great many products that are essential for the United States in fighting COVID-19. And I know that this will be a very constructive discussion, as we always have and always have had.
We will continue to work very, very hard to remind the Americans, as I will in my conversation with President Trump when it happens in the coming days, that we are, both of us, interlinked in ways that means that it would hurt both of our countries in our ability to protect our citizens were supply chains to be disrupted. There are Canadian health professionals right along the border with the United States who engage in supporting American medical systems in a daily basis, and that would be something that is valuable to the United States. It's also extremely valuable that we are part of essential supply chains for things from testing kits to gloves to the ingredients in N95 masks. We know that we do better when we work together, and that'll be my message to the President.
Are you open to postponing the implementation of the agreement? Well, we will be working with the Americans and Mexicans to see when the new NAFTA should come into effect, but this is something that we will continue to work on, but our priority right now is COVID-19.
With Mexico and the United States on the ratification of the new NAFTA, but as a reminder for everyone, the existing NAFTA is still very much in place and will remain in place until such a time as the new one is brought in. The people who are working, who usually work very, very hard on ratification of trade deals, like most people in government, are very much focused on our response to COVID-19, and that needs to be our priority right now. Merci beaucoup tout le monde. Merci tout le monde.